Passes or not, some argue it's almost beside the point, and that's what's really needed is a bold, even radical treatment strategy. Earlier today, I spoke with Dr. David Juurlink, a drug safety researcher. Now, he didn't pull any punches over what he thinks Canada should be doing. Let's begin with the government's plan, which is to try to stop the fentanyl from getting into the country by stopping it at the source of mail, where some drug dealers are mailing this. How effective do you think that's going to be?
It's not going to work. You will be able to interdict some fentanyl, but there'll always be another package in the mail to follow it up. I mean, the demand is simply too high. There's too much money to be made by organized crime. It's just not going to work. It's a classic supply-side solution to a problem that needs much broader intervention.
Okay, so if not that, then what?
Well, I think a focus on harm reduction. Giving people who use opioids access to places where they can use them safely, like supervised consumption sites that we're seeing now pop up across the country. Access to cleaner prescription drugs that don't carry with them the acute risk of death that fentanyl does. And maybe thinking about a change in how we approach drug laws in our country.
Are you talking about legalizing it?
I think it's something that has to be on the table. I mean, other countries, Portugal has done this. It's not, the problem hasn't gone away in Portugal, but at least the guy in Portugal who is, holding down a job and using heroin several times a day knows what he is getting. He is not injecting himself with fentanyl and dying in a public bathroom for lack of a more progressive approach to drug addiction. This is a public health problem. It's not a criminal problem. And the sooner we treat it as a public health problem, first and foremost, the better off we'll be.
When you consider how long it's taken Canada to get to the point where it's going to legalize the use of marijuana, and we're in fact still not there, how likely is it, do you think, that we would look at the use of opioids in a legal context?
Well, not just opioids, but other drugs as well, ecstasy and magic mushrooms, and I think there is going to be opposition to it. But I think a case can be made that in the interest of public safety, it's something that has to have an open discussion. I mean, a lot of the objection to this is on moral grounds. People they have always used drugs, they're always going to.
But isn't that walking away from trying to restrict the flow of the drugs by saying we're just going to acknowledge that they're coming in and treat it there?
Well, I understand the desire of a government to try and say, listen, we can stop these drugs from coming in. The problem is there will always be another package in the mail. And even if you could somehow magically stop the inflow of fentanyl into Canada, somebody can make it in a lab here. It can be made domestically. This is just not going to fix the problem.
Do you think that the greater public has an understanding of how serious the problem has become?
Well, it's in the news every day or every second day. You have to be living under a rock not to appreciate it.
And yet people are still dying.
Well, that's in part because people with addictions can't just stop their therapy. I mean, they will use drugs because the alternative to using them is becoming extraordinarily sick, and they'll take that chance. And so I think that's part of the problem, and helping those people not die today, I think, is really the key to turning this around.
If you come at it from the mail service, the people who are mailing the drugs to you, by and large, would be a drug dealer trying to get it to a customer. But the opioid problem is also because of overprescribing of these drugs. How do you deal with that?
It's a multifaceted problem, and in fact, you're right that part of this has its genesis in the overprescribing of pain medicines by doctors for the last 20 years, not based on good data, but based on messaging that really at its core came from the companies that have made billions of dollars from these drugs. What I think we have to do is prescribe opioids differently, but be mindful of the fact that you can't just stop someone's opioids and take them away suddenly. Those people will be driven to the street, and they will go from a legitimate pain patient to somebody who is at risk of death from just whatever they can get their hands on, so they're not in opioid withdrawal.
If you were in a position to wave a magic wand, make something happen as of today, short of just getting rid of fentanyl, what would you do?
I would ensure that governments coordinate federally, provincially, and municipally. You can't point a finger at the feds and say it's their problem. The provinces have lots to do as well in terms of real-time data collection and funding drug therapies for people with addiction, and funding care for them. Supervised consumption sites should be all over the country. They should have been all over the country years ago. People are losing their children because those sites don't exist as much as they should. And we should have Narcan, the reversal drug, everywhere. It should be in nightclubs and restaurants and corner stores. But I think we also have to view the role of opioids differently than we've been taught to. And we might want to think about changing the rules in Canada. It's a very draconian suggestion, but people have always used drugs. And they're always going to use drugs, and there are always going to be people who try and stop them from using drugs. When you do that, something dangerous often takes its place. Something more dangerous often takes its place. That's why fentanyl is here. It's here because people can't legally use heroin, for example, in Canada. And I think it's long past time for the politicians to give that concept some thought.
Thanks for this.
My pleasure.
One thing